Where my girls at? Independent, free spirit. Ooh, it's some serious. Where my girls at? We ain't linked up in a cool minute. Where my girls at? It's going down, down. Where my girls at? It's going down, down. It's going down tonight. We going out tonight. Yeah, right. We going out tonight. It's going down tonight. Yeah, right. It's going down tonight. We going out tonight. Yeah, right. We going out tonight. It's going down tonight. Yeah, right.
Good evening, and happy Friday. I am so excited to be your host today on We Got Issues. I am sitting in for the girlfriends of the Force of Friendship who are enjoying and having fun in the sun in Hawaii. Aloha, ladies. Krista, Katrina, Sabrina, and Gloria. I know you ladies are having a blast, and they have their husbands with them too. I am Carolyn Jackson Muse, and I have been listening and watching We Got Issues since the inception, and I have learned so much from these ladies and their guests, from decorating ideas, dealing with narcissistic people, COVID results, how to invest, and so many other topics that some of them I had no clue about. So today we are here to learn from a family care physician who just happens to be my goddaughter. And he's the best doctor in the whole wide world. And I don't say that just because she's my daughter. Her expertise speaks for itself. Now, so I'm going to read her accolades and accomplishments, and then she will tell you about herself and why she became a doctor. We will dive into our topic today, and it's the do's and don'ts about diabetes. Dr. Tra'Chella Johnson Foy is a native of Jacksonville, Florida. She graduated from Rudolph Senior High School and then went on to the University of Florida, where she completed her Bachelor's of Science in Psychology. She completed her medical training at Morehouse School of Medicine and did her residency at Mayo Clinic in Jacksonville, Florida. She completed a mini fellowship at Harvard AIDS Institute and is an author at AIDS.
Yes, you're on the radio. I'm sorry. Juan.
And she was the first African-American woman to hold this position. Most recently, she was awarded the George Trotter Founders Award from We Care Jacksonville in 2020. She has been voted one of Jacksonville's top doctors by Jacksonville magazine in the last 5 editions. She is also the nationally recognized Patient Choice Award for 11 consecutive years and Most Compassionate Doctor 2011 through 2021. In addition, she was presented the Most Honored Physicians Award. She won the Woman of Steel Award in 2015 and the Woman of Endurance Award from Jacksonville Business Journal. She also recruited 20 underscore Jacksonville Black Agents. She's a member of the 2007 class of Leadership Jacksonville. Dr. Johnson Foy has received numerous other awards, including Duval County Healthcare Pioneer Recipient, the Morehouse School of Medicine Primary Care Award, Mayo Clinic Jacksonville Patient Award, and the AAFP Bristol Myers School Award in Graduate Medical Education and University of South Florida Outstanding Teacher Award. She volunteers for We Care Jacksonville and works as a motivation. She's an active member of the Northeast Florida Medical Society, Duval County Medical Society, Florida Medical Association, and the American Academy of Family Physicians, and is chosen as one of 9 physicians for the with beauty services and Platinum Crest Salon on the corner of Southside and Atlantic Boulevard. They have been a staple in the community for the last 21 years. She's been married 13 years and has a 6-year-old son who is my grandson, Lamont Foy Jr. One of her mottos is forget not to serve others, and others will not forget you. Now, I don't know how long we have before the break, Dr. Foy, but we're going to get you to. Okay, we're going to bring you on 1 second. And get this show on the road. Thank you so much for joining us tonight. And let's see if we can get to that. Welcome to We Got Issues. I am so delighted that you're here to join us tonight. I know you have a very, very busy schedule, so thank you so much for taking time out of your schedule to join us. And I have shared all of your accolades, but we just want you to tell us a little bit about you and why you decided to become a doctor. And don't leave anything out, because it's out the story. Just tell them why you decided to become a doctor.
So, again, I appreciate you allowing me to speak this evening and having me on this wonderful show. So the idea of becoming a doctor here at the hospital is kind of from birth, but there's a lot of things that were happening in my life that didn't want to pass the typical person who is going to go to the doctor. Both of my parents were on drugs. I was living in terms with neglect and abuse and not caring for abuse, but unfortunately. And so then I was in about the fifth grade, regardless of all the things that was going on around, but I was still a kid who, was always kind of helpful and not trying to be stupid and not thinking about people. And so I lived in California, in Jacksonville, Florida, and, I took my risk and was neglected. And unfortunately, one day, as one of my friends walking on past that wall, he actually got bumped up in the quite definitely after that, things kind of got worse into the 80s, and that took crack cocaine that really radically my neighborhood. And unfortunately, like I said, both of my parents traded that. Because of that, when you're young, you usually, no matter what's going on in your life, you want to be the parent you love your parents, and you just want to be there where they are. And I initially thought that unfortunately that led us to living in a abandoned townhouse that used to be my grandmother's house. And ultimately, I became hold that thought. We have a break. And after the break is over, we're going to continue this conversation.
Yes, we're back. We're back now. I see your beautiful face. Thank you so much, Dr. Foy. Today, our special guest is Dr. Tra'Chella Johnson Foy from Jacksonville, Florida, and we're discussing diabetes. I've read that diabetes is a chronic, long lasting health condition that affects how your body turns food into energy. Black adults in the U.S. are 60% more likely than white adults to be diagnosed with diabetes. So, as you tune in today and listen to Dr. Foy, we were continuing a conversation before the break. Dr. Foy, you can finish that sentence you were saying.
No, I think I was just talking about the fact that as a child, you want to spend all your time with your parents, no matter what the circumstances. And I just got to a point where it was very depressing and very depressed after we were kind of living in an abandoned crack house that used to be my grandmother's home. And so I started to question my existence and question why I was here and what was the meaning of my life. And so I prayed for a while, asking God to just not wake me up, because in the world that I grew up in, you couldn't commit suicide because you were just looking forward to hell for eternity. And I was already living a hell on earth and did not want that. So as I continued to ask God to just not allow me to wake up in the morning, I kept waking up. And because I kept waking up, I then had to change how I was asking the question. And I realized I had to, instead of asking God, why am I waking up? I had to ask myself, why am I waking up? What is this? Why am I still waking every day? And then that's when I realized it clearly was for a purpose, a reason, and that I must have had some divine reason for being here. And this idea of being a doctor played into that at that point. But I knew that I was here to be of service to others and to allow God to just guide me and use me as a vessel.
Awesome, awesome. Thank you so much. And listen, I just want to thank you for being who you are. I've known Dr. Foy since she was 17 years old. And if y'all are on Facebook, y'all can see we kind of favor. I didn't birth her, but a lot of people think we are mother-daughter for real. So I met her when she was 17. So I watched her go through high school, college, medical school, her residency, and all of that. And she is the doctor that will not quit. This is her heart. This is her passion. And we love her. So now, Dr. Johnson, I have a question because you are so good at this. For people that have diabetes, that's a big thing. What do you say to people that are diabetic and they're on medication?
Well, the first thing I want them to know is that if they have diabetes, one, medicine is your second defense, not your first defense. The first treatment for diabetes, first and foremost, is lifestyle, is making sure your nutrition and your exercise are being used as a medicine to treat your disease. Any pill or shot that comes after is meant to assist or help those lifestyle changes, and that you're not meant to be just dependent on a medicine for your healing and for your treatment. It goes back to how you're eating, what choices you're making with the foods that you put in front of you and the foods that you ingest. So that's the first thing that I try to help people understand, that first and foremost, lifestyle changes, and not lifestyle changes to go to the wedding and fit the cute dress or buckle your pants all the way. No, it is every time you eat, you should be thinking about, how is this going to affect my sugar? How is this going to affect my long-term health? Even more so than how is my medicine working? So that's the first thing. Next, I would say, take it. You have to take your medications in order for them to work, because them sitting on a shelf after you paid your good hard money for them aren't doing any good for you or your pocket. So you have to take your medicine. Make sure you understand the right way to take your medications. And ask your doctor if you're not clear. If you don't know how you should take it, what time of day, when, before you eat or after you eat, then have a good conversation with your doctor. Sit down with them and have just a visit where you go over the medications. If the medication is making you feel bad, that is not something your doctor wants you to be on. I know you guys may think that we just want to give you a medicine and don't think anything else about it. That's not the case. We never want you to be on something that makes you feel worse than your disease does or that your condition does. So if you feel poorly, let the doctor know. Say, this isn't working for me. We used to live in a time where we didn't have a lot of choices, but it's a whole new world when it comes to diabetes. And we have lots of choices, lots of opportunities to treat you differently and to make sure that a medicine isn't making you sick. They're make them change it. If you have someone who is insistent that, well, just suffer through or suck it up, then that's probably not the right position for you, because a good doctor is going to take their time and say, okay, well, first off, tell me what's happening, so that they can make sure that it is about the medicine and from the medicine and not something else. And once they have made sure that it is, yes, it is likely that you're having some symptoms from it, even if we're not 100% sure, even if there's a possibility that something else is going on, there's just too many other choices to make somebody stay on something that they even think is making them feel poorly. We just change it. And so you have good open conversations about, hey, this doesn't make me feel good. Don't suffer through it. And you don't have to wait until your next appointment with them. Call them and tell them pretty quickly, because otherwise you're going to get frustrated. You're not going to want to take it at all. And then anything else that they might even consider giving you, you'll be hesitant about. So we don't want you suffering through anything. Our goal is to help you get better. And if something isn't making you better, then we're not going to continue it.
Awesome. Awesome. Thank you so much. I know we have some callers out there. I know you have some questions you want to ask Dr. Foy. Please call us at 313-778-7600. She can answer any questions you have. Maybe there's somebody in your family that is suffering with diabetes and you have some questions. Please call in and ask Dr. Foy about that. So now we're going to ask you, Dr. Foy, if the person is a diabetic, they're not taking their medicine, what could they do to be a good steward of what the doctor has told them?
So I have a lot of people who come in and what they say is, I'm not claiming no diabetes. And I understand that. I understand that, we think back in our minds of Aunt Sue, who was on insulin and had an amputation or just seemed like she was sick all the time. And so that's the vision we have of what we are, what's destined for us. And so I try to explain to people, you can control diabetes. Diabetes doesn't have to control you. So if you make sure you're the captain of the team, all of those things that you're fearful of, all of those things that you worry about, don't have to come to play. They don't have to come to fruition. So diabetes can be something that causes pause and makes us a little bit frightened and uncertain. When you know that, yes, it is the number one cause of amputations that are not accidents. It is the number one cause of chronic kidney disease. It's the number one cause of blindness from a medical condition. But the key word is actually, it's the number one preventable causes of these things. Those things don't have to happen. They're all preventable if you do the right things. And if you do the right things early on, then you have a better opportunity to get in front of it. If you do the right things early on, you're not playing catch up. If you wait until the car you're driving has thrown a rod because you weren't changing the oil, then yes, you're going to be stuck without a car. The same thing about this body of yours. If you wait until the damage has been done, yes, the damage is done, but you can get ahead of it. So if you, again, put lifestyle first, nutrition first, and do the things that you can do, so you can feel good about knowing that I've played my part, I've done my role. Make sure your doctor has sent you to a nutritionist, because we all think we know how to eat, but you'll be surprised at what has carbs and what is going to be more likely to make your sugars go up, how many calories you're truly taking in. All of those things will be things that are surprising to you. So you should see a nutritionist. Everyone should see a nutritionist, but especially if you have a condition like diabetes. Know that you are the captain of the team, but that you do need a team. So that team involves you as the captain, your primary care doctor as your co-captain. And sometimes if your diabetes is poorly controlled enough or poor enough or hard enough to control, then you may need an endocrinologist, which is a special diabetes doctor. But most of your primary care doctors can handle your diabetes. You don't have to see an endocrinologist. However, if you run into one that doesn't really know how to guide you, then ask to go see an endocrinologist, which is the diabetes specialist. Make sure you have an exercise specialist, a mental health provider like a counselor, because the idea of sticking yourself every day and having to watch everything you eat can be a little bit daunting and can be depressing at times. And so making sure that you have the right mindset and it helps have someone who guides you through it is going to be helpful for you. And then family, good family. I know we don't want to tell our business, but
Okay,
it's helpful
Foy,
to have someone around you who knows.
Thank you so much. We have a break. I hear the music. We have a break. And after the break, we'll be right back and continue this conversation.
Yes, ma'am.
All right. And we are back. I know y'all wondering where the girls at. They're in Hawaii having a blast. Hey, Voice of Friendship, we miss you. Dr. Foy, we have a question. Red Clark said he have an A1C of 5.7. What can he do to bring it back within range?
So the question would be if Red has been diagnosed with pre-diabetes or diabetes. And so if he is actually been diagnosed with diabetes and his A1C is down to 5.7, then that is excellent. There's not a whole lot more you can ask for. You are doing phenomenal. My goal for my patients is for it to stay less than 6.5, which is usually going to be their recommendation for endocrinologists. But honestly, we try to look at people as individuals, because if some people are older and they're sicker, then their A1C being allowed to be a little bit higher is not unusual, because we don't want them to get so sick where their sugars drop low and they pass out, which can be more dangerous than the sugar being a little bit high. But if you are if you're pre-diabetic, which 5.7 is the cutoff for normal and abnormal sugar, if you're in that pre-diabetic range, then really focusing in on nutrition is going to be the key. Studies have shown that if you really minimize your carbohydrates, so things like pasta, potatoes, bread, rice, grits, all of those things that when we think about them aren't necessarily sweet when we eat them, but they get turned into sugar inside of our bodies. And so many people think about cookies, cakes, pies, and the desserts, but you're not eating that all day, every day. So that's not really your biggest problem. The concern is more so those things that get turned into sugar. So finding a way to minimize those are going to be important to helping you keep your sugar controlled. So for instance, I have patients, and if you're from the South, a lot of times you think rice goes with every meal. It does not. You do not need or have to have rice with every meal. And so it's one of those things that, although I'm probably going to be cursed by every Southern mother, that you don't have to have rice. It is not a necessary staple. And because of that, when you just do small things like take something like that out of your diet, you have a great opportunity to decrease how many carbohydrates you're taking in, decrease how many calories you're taking in, lose weight, and have your sugar be under control. You should focus on the types of carbs that are healthier carbs, like things that are whole grains or vegetables. Some people don't know that all vegetables are carbohydrates, all of them, not just the ones that we consider starchy, like corn and potatoes. All vegetables are carbs. So you can still have carbs and have good, healthy carbs like broccoli and other types of veggies that will keep you full, keep you satisfied. They aren't as high in calories, and they're much more nutritious for you than something like having rice or pasta or potatoes will be. If you're going to eat potatoes, sweet potatoes are best. If you're going to eat things like that are starchy, you want to eat things that are whole grains, not anything enriched, because that means all of the good nutrients have been taken out and some stuff been put back in. So it's been processed in a way that's not necessary. So you want to focus in on nutrition in a way where most of your food does come from things that don't have a mama, but that doesn't mean you just have to be a vegetarian, because the people who live the longest actually have more of what's called the Mediterranean diet, where it's full of beans and healthy carbs, healthy, nutritious grains, nuts, healthy oils like olive oil and avocado oils, salmon. They eat salmon at least twice a week, and not just salmon, but fish, healthy fish at least twice a week. So those are, you can still have a balanced diet where you don't feel like you're being starved or feel like you're being punished with the nutrition that you take in, and you can use that to keep your sugars controlled. And then studies have shown that using the medicine called metformin and some other medicines, because we live in a whole new world. So depending on what conditions you have, there are other things that medicines we can use right away that will help your sugars stay in that range, in the pre-diabetic range or lower, so that you don't have complications from diabetes.
Awesome. Awesome. Thank you so much, Dr. Foy. I hope that answered your question, Red. You can call us at 313-778-7600. I know you have other questions. I know you might want to ask Dr. Foy a different question. It might not be about diabetes, but our show today is the do's and don'ts of diabetes. Thank you so much, Dr. Foy. Call us today. Call us 313-778-7600. Now, my next question is, when there's a child that has been diagnosed with diabetes, the parent has to be educated to take care of the child. So what would you suggest that parent do to help that child, or she really has to do everything for that child because the child doesn't know how to take medicine or do the numbers or any of that? What would you say to a parent that has a child with diabetes?
Wow. And so that's a very good question because it helps us to kind of clarify the different types of diabetes. You have actually two different types of diabetes. And when it comes to children, children are most likely, or used to be most likely to have type 1 diabetes, which is a type of diabetes where your body just doesn't make insulin at all. And the only way to treat it is to be given insulin. So they don't really have a choice. Those medications are not available for them. Nutrition is important, but it cannot be controlled at all with just nutrition. You are likely to be able to keep it under better control if you eat the proper thing and that you manage the amount of carbohydrates you put in your body. But it's really going to take medicine for young children who have type 1 diabetes. Now, with that being said, we live in a country with, unfortunately, an epidemic of obesity in our children. We have the most obese children in the world. So at this point, we actually have most children who are diagnosed with diabetes having type 2 diabetes as opposed to type 1 diabetes. And type 2 diabetes is the one that is mostly related to how you eat, nutrition, family history. Those things are what guide this disease. And so focusing in on keeping our children healthy while they're young is the best thing that parents can do to avoid them developing either pre-diabetes or diabetes. So again, if you're buying the groceries, you control what is going into this child's mouth. So start with that. Buy things that the whole family can eat that's nutritious, because the likelihood is that if you have a child that is pre-diabetic or diabetic, then someone in the family is too. We're likely dealing with obesity in the family and not just in that child. We in our culture sometimes think if a child looks too thin that they're not healthy enough. And so we will overfeed them or we will try to fatten them up. Well, in doing that, you oftentimes are kind of driving this diagnosis of diabetes, and especially this type 2 diabetes. You can't give them type 1 diabetes, but you can feed and support type 2 diabetes. The first place it comes from, though, and the number one risk factor is not necessarily their weight and how they eat, but their family history. So if you can make sure that you are avoiding it in yourself and that you're finding ways to keep yourself healthy, then the children will follow. Nutrition is just one part of it. Exercise becomes very key and important. So we, of course, live in a time where children spend less time outside and they're used to sitting in front of the television or sitting in front of their games. They don't actually even need the television anymore because anything they're interested in is on a tablet or on their phone. And so we have to put the tablets down, put the phone down, and let's go outside together, walk, play, throw the ball, kick the ball, run. Those are things that a parent can do to help keep their children, their diabetes controlled or to keep them from developing diabetes. When you sit in front of television, studies have shown that definitely children are more prone to be obese and more prone to develop diabetes when they have more screen time. So limiting screen time is going to be important. And I know we're all busy. You know, I sometimes have to give my son the tablet and be like, okay, mama got to do this. But he is not going to live and die by the tablet. On Saturdays, I'm signing him up for everything we can do. So during the week, we have basketball practice, softball practice, baseball practice, soccer. swimming, and you know, and he's 6 years old and he has played every sport except football because I'm afraid of concussion. But we have played everything. We watched some football, but we haven't played just yet because I want him to not have some of those problems that we know run in Black families. I want him to develop a habit of exercise now so that as he grows and gets older, it's something that is a part of his life. So start planting those seeds now.
Awesome. Thank you so much for that. And Red said this did help. And callers, we need you to call 313-778-7600 with your questions. We're going to take a break and we'll be back after the break. Welcome back. Welcome back. I think we have a caller. Tia, are you there? Thank you so much. Great. Thank you so much for calling.
I'm a comment and a question. I am really glad that you have this segment. And I am really pleased with the doctor that you have on. I just want to say is that when I hit my certain point in my 50s, I ended up getting diabetes. I got it after I had an accident, and I the years in my life. She her solution was to like flip. We never really got a chance to talk about how to deal with lifestyle. So I had to be my own nutritionist, my own researcher, and I started researching certain things, and that's when I did like the doctor was telling me dietary changes. I gave her high blood syrup, added sugar, and you'd be surprised how much added sugar is in the foods that we eat nowadays. And I started making everything from scratch. My A1C was at the highest 11.2, and then it dropped to 10.8. When I started getting rid of sugar, it dropped from 10.8 to 6.1 in 5 months. And so that's where I am right now. I'm at 6.1. I'm trying to get back to normal, in the normal range, like 5.4, 5.3. But my glucose numbers are great. I would have to say, I wish I had a doctor like the doctor that's on now who could talk about those things. And I'm so glad to hear that she said the diet, exercise, your first points to go to, and then use medication. I didn't have that kind of support. So I would just like to just say thank you to the doctor that's on, because that's the kind of support that we as African Americans need to hear and that we need to see, just to make some dietary changes. If you keep eating the same food but you're taking medication, you're going to always have diabetes. You're going to always be on medication. So I just wanted to thank the doctor for this segment. I want to thank you for this segment, and I want to thank the doctor. I wish he was my doctor this way. I'm looking for a new doctor now, but I had to do my own work. And my doctor she was not pleased with me. She told me whatever I ate my mouth would not help me, and I had to get on insulin. And I had to prove to her that I didn't need insulin. And the things that I ate by mouth, I made some changes too, and then my numbers started to drop dramatically. And so the other question that I have is I'm trying to get over the hump. I'm trying to get from 6.1 to like 5.4, 5.3. There'll be some recommendations. I'm almost there, but not quite. So, and I don't take insulin, and I don't take the medication. So. Well, first off, congratulations
to you, and what a wonderful job you have done as being your own champion. And that's what it takes sometimes. So I'm glad that you didn't get discouraged and that you really kind of grabbed the bull by the horn and did the things you needed to do to get you to where you're supposed to be. So in the context of, well, how do you get from 6.1 to 5.4? I will say, first of all, 6.1 is excellent. You're really doing great. And we do worry about your sugars being too low. That actually can make you feel bad. And that actually can make you feel, that can be a little bit dangerous for you. You're more likely to kind of pass out or be laid out somewhere because your sugar drops too low. So at this point, I would recommend, what I would tell my patients who are at 6.1 is, how do we maintain this? How do we make sure that we don't start moving in the other direction? And if you have incorporated it into your lifestyle, then you're doing what you're supposed to do. If your goal might be more so to not get on medicine, or to not be the person who has to add a medicine, if you know you're not taking it. And I would be really straightforward with your doctor about the fact that you're not taking your medicines, because if I had someone who is at 6.1, they're not taking any medicine, we doing a dance together in their office, and I'm taking it off their list because they've earned that, because they've done the work. Now, there may be some things you still need to be on to like protect your kidneys and to decrease your risk of heart disease, because even when your numbers are good, you should still likely be on a statin, which is a cholesterol medicine, because your risk of heart disease
is there. So make sure you're clear with your doctor about what you're taking and what you're not taking. But don't necessarily look for 5.4, I would say. So, and this is not you telling you to be persuasive. This is me encouraging you really to embrace where you are. If you're pushing it and you do it now. If you know that, okay, I still have ice cream on Fridays, or I
help make your body increase its own insulin. So if you're not exercising, try to get in 30 to 45 minutes, 5 days a week. That actually helps to bring your sugar down even more. So if you want to see that average, because 6.1 means your sugar is averaging about 120 to 130 all the time, that's actually pretty good.
Okay, great. Yeah, my sugars are between like 98 and 120, and great. I don't have high blood pressure. My cholesterol is actually fine. My triglycerides are high, but they drop. So this is great information, and I wish you were here. I would switch to you for my doctor, but I really appreciate this information. Thanks for being such a great cheerleader. Thanks for the show. I appreciate it. Have a nice one.
You too. Congrats again.
Good work.
Thank you so much for calling in, Tia, and I'm so glad that Dr. Foy was able to assist you in your um, walk in the diabetes program or whatever you're doing with it. And what you've done has been phenomenal. We thank you, Dr. Foy, for all of this good information. We got issues as a show. Everybody has issues. But this issue with the diabetes is taking the world by storm, and Dr. Foy is a specialist in this field. So I thank you, Melissa, and I thank you for our viewers. I thank you for Tia calling in. I thank you for Red asking the question. I thank you for the girlfriends trusting us with the show today, and hope they are having a great time in Hawaii, which I know they are in Hawaii. Yes. Thank you, Dorothy. Thank you, Michael. Thank you, the staff. Thank you, Dr. Tra'Chella Johnson Foy. And if you want to move to Jacksonville, Florida, she will be your doctor. She'd be glad to be your doctor. But we're not going to let her leave our city. We love you guys. We got issues. And tune in again Monday evening. Thank you for joining us. Every Monday through Friday, 6 to 7 p.m., we got issues. And we'll see you Monday with the force of friendship.